Hey guys, in this video I'm going to be looking into heart rate and heart rhythms in Japanese. I'll be covering some of the main vocabulary that comes with measuring heart rate, the ways to measure heart rate, and some of the main rates and rhythms of the heart you may encounter. I'll also break down the words in kanji to make it easier for you to read and understand and implant it in your memory. So let's get straight into it. So I'll first go over heart rate, which is the number of times the heart beats per minute, and the word for heart rate in Japanese is shinpakusu. Breaking the word down, we first have the kanji shin, which is the kanji for heart or cardiac in medical Japanese. The kanji shin is then followed by the kanji for beat, paku, and then ended with the kanji su for number, together making heartbeat number or shinpakusu, which is heart rate. So remembering that the heart rate is the number of heartbeats will help you remember the word shinpakusu for heart rate. We next have the word pulse rate, which is the number of palpable pulses in a minute, usually measured at the wrist, neck, or other arteries. The word for pulse rate in Japanese is myaku hakusu. Breaking the kanji down, we first have the kanji myaku, which means pulse. We then have the kanji for beat, haku, this time with the original haku reading rather than the paku reading which we saw for heart rate. This is something you sometimes see in Japanese when a voiceless consonant, like H, is the second part of a compound word. It may change into a voice consonant like B or P. This is used to make the word sound more natural and smooth in speech. So after haku, we again have the kanji su for number, together making pulse beat number or myaku hakusu, which is pulse rate. So again, another very literal translation there. And just a note, heart rate and pulse rate are often used interchangeably in conversation when referring to someone's heart rate, except for when they're needing to be specific about whether it's a heart rate or a rate measured from a pulse. So the normal values when it comes to heart rate for an adult is generally 60 to 100 beats per minute, and the Japanese word for normal values is seijouchi. Breaking the word down, we first have the word for normal, seijou, followed by the kanji chi, which means value, together making normal value or seijouchi. I've highlighted this word as this is a general word for normal values, not a word specific to the heart, so it's a word you'll commonly encounter in medical Japanese. And just a note, what's considered normal can differ depending on the person's age and health condition. So examples of that would be that infants and children generally have normal values that are higher than that of adults, and very physically fit athletes, often endurance athletes with well-conditioned cardiovascular systems, can sometimes have healthy resting heart rates that are lower than the standard values. Next I'll go over fast and slow heart rates. So when someone's heart rate is over 100 beats per minute, it's called tachycardia, which in Japanese is hinmyaku. Breaking the word down, we first have the kanji hin for fast, followed by the kanji myaku for pulse, together making fast pulse or hinmyaku, which is tachycardia. So remembering that tachycardia means fast pulse will help you remember hinmyaku. And then we have bradycardia, which is jomyaku. Breaking the word down, we first have the kanji jo for slow, followed by the kanji myaku for pulse, together making jomyaku or slow pulse, which is bradycardia. I'll now go over some of the ways of measuring heart rate. So we first have pulse check, which is when you place your index and middle finger gently over an artery to feel a pulse as seen in the image there. So the word for pulse check in Japanese is myakuhaku sokute. Breaking it down, we first have the word myakuhaku, which combines the two kanji myaku for pulse and haku for beat, which we covered earlier, with the two kanjis together making the word for pulse. Followed by the word sokute, which is the word for observation or check, together making pulse check or myakuhaku sokute. You can also assess a heart rate by listening to it using a stethoscope, and the word for stethoscope in Japanese is choshinki. Breaking the word down, we first have the kanji cho for listen, followed by the kanji shin, which means diagnose, and then followed by the kanji ki for instrument, together making listen diagnose instrument or choshinki, which means stethoscope. We can also measure heart rate using a pulse oximeter, which in Japanese is pulse oximeter. So as you can see, this word is in katakana and has been taken directly from the English word pulse oximeter. An electrocardiogram or ECG can also be used, and the word for ECG is shindenzu. Breaking the word down, we first have the kanji shin for heart or cardiac, followed by the kanji den for electric, and then the kanji zu for diagram, together making heart electric diagram or shindenzu, which is an electrocardiogram or ECG. So remembering that a recording of the heart's electrical activity in a diagram is produced by an ECG will help you remember shindenzu. I've also got here Holter monitor or Holter monitor. A Holter monitor is effectively a portable ECG, but I've just put it in here as it's a common device you may encounter for measuring heart rates and rhythms. I'll now go over regular and irregular heartbeats. So a regular heartbeat is often referred to as normal sinus rhythm, and the word for normal sinus rhythm in Japanese is seijou do choritsu. Breaking the word down, we first have the word for normal, which we covered earlier, seijou, followed by the kanji do, which refers to the sinus node, with do being the first kanji in do kessetsu, which is the word for sinus node. The sinus node is the area of the heart that generates electrical impulses to initiate each heartbeat. So this is then followed by choritsu, which means rhythm or tuning. So altogether it's a literal translation of normal sinus rhythm, which is seijou do choritsu. Now when a heartbeat is of irregular rhythm, it's called an irregular heartbeat or arrhythmia in medical terminology. And the Japanese word for this is fuseimyaku. Breaking the word down, we first have the kanji fu for not, followed by the kanji se for regular, and finished off with the kanji myaku for pulse, together making not regular pulse or fuseimyaku, which means arrhythmia. So another literal translation there. I'll now cover some of the common types of arrhythmias. So you first have tachyarrhythmia, which is a fast irregular heartbeat, and the word for this in Japanese is himmyaku se fuseimyaku. Breaking it down, we first have the Japanese word for tachycardia, himmyaku, which we covered earlier, followed by the kanji se for type, and bookended with the word fuseimyaku for arrhythmia, together making tachycardia type arrhythmia or himmyaku se fuseimyaku, which is tachyarrhythmia. And when a heartbeat's slow and irregular, it's called a bradyarrhythmia, which is jomyaku se fuseimyaku. Breaking the word down, we first have jomyaku, which we covered for bradycardia, followed by the kanji se for type, and finishing with the word arrhythmia, fuseimyaku, together making bradycardia type arrhythmia or jomyaku se fuseimyaku, which is bradyarrhythmia. So just remember type arrhythmia, se fuseimyaku, and just add himmyaku for tachyarrhythmia and jomyaku for bradyarrhythmia. Next we have atrial fibrillation, and the word for this in Japanese is shinbo saido. Breaking the word down, we first have shinbo, which is the word for atrium, the upper chambers of the heart. This is followed by the kanji sai, which means fine or small, and then the kanji do, which means movement. And when these two kanji are put together, in medical Japanese it means fibrillation. So putting the whole word together, we have atrium fine movement or shinbo saido, which is atrial fibrillation. So to remember this word, remember that in atrial fibrillation, the chaotic movements of the atria causes fine or small disorganized electric signals in an ECG. We also have atrial flutter, which is shinbo sodo. Breaking the word down, we first have the word for atrium, shinbo, followed by the kanji so, which means coarse or rough, and then ending with the kanji do for movement, all together making atrium coarse movement or shinbo sodo, which is atrial flutter. So to remember this word, remember that unlike atrial fibrillation, the movements in the atrium is a little more organized, causing a more predictable rhythm with more coarse or distinct patterns in an ECG. Next we have ventricular fibrillation, which is shinshitsu saido. Breaking the word down, we first have the word for ventricle, shinshitsu, which are the lower chambers of the heart, followed again by the kanji sai, which means fine or small, and do for movement, which together makes fibrillation, so all together making ventricle fine movement or shinshitsu saido, which is ventricular fibrillation. And we've also got ventricular tachycardia, which is shinshitsu hinpaku. So first we have the word for ventricles, shinshitsu, followed by the word hinpaku, which means tachycardia, together making ventricular tachycardia or shinshitsu hinpaku. And just a note, the word hinpaku rather than himmyaku is used for tachycardia in arrhythmias that involve abnormal heartbeats, as there's more of a focus on fast abnormal heartbeats, hinpaku, rather than increased pulse rate, himmyaku. Next we have premature beats, and the word for this is kigai shushuku. Breaking it down, we first have the kanji ki for period, followed by the kanji gai for outside, followed by the word shushuku for contractions, all together making period outside contractions or kigai shushuku, which is premature beats. So remember that premature beats are caused by premature heart contractions. To remember, kigai shushuku. And we also have atrioventricular block or AV block, which is when electric signals from the atria to the ventricles are blocked or delayed. The word for this in Japanese is boshitsubloku. Breaking the word down, we first have the kanji bo, which refers to atrium, with it being the second kanji in shimbo for atrium. This is followed by the kanji shitsu, referring to ventricles, as it's the second kanji in shinshitsu for ventricles. This is followed by blokku, which is from the English word block, altogether making atrium ventricle block or boshitsubloku, which is atrioventricular block. And that's the end of the video. If you'd like more videos that break down medical Japanese to make it easier for you to learn and remember, please subscribe and check out the channel. Thank you for watching.